My name is Britta.
I'm Leah.
I'm Jenna. And I'm Michelle.
Today we're going to talk about female genital mutilation in Nigeria. It covers concepts like dignity, power, and traditional practices. And I'll pass it on to Michelle.
Female genital mutilation, or FGM, is defined by the World Health Organization as all procedures which involve partial or total removal of the external female genitalia or injury to the female genital organs, whether for cultural or any other non-therapeutic reasons. In Nigeria, subjection of girls and women to obscure traditional practices is legendary. FGM is an unhealthy traditional practice inflicted on girls and women worldwide. FGM is widely recognized as a violation of human rights, which is deeply rooted in cultural beliefs and perceptions over decades and generations, with no easy task for change. FGM is practiced in more than 28 countries in Africa and a few scattered communities worldwide. Its burden is seen largely in Nigeria, which has the absolute highest number of cases of FGM in the world. Although 37% of circumcised women do not want FGM to continue, there is still considerable support for the practice in areas where it is deeply rooted in local tradition. The aim of our podcast is to determine the current status of FGM in Nigeria. FGM is a practice whose origin and significance is shrouded in secrecy, uncertainty, and confusion. The origin of FGM is fraught with controversy, either as an initiation ceremony of young girls into womanhood or to ensure virginity and curb promiscuity.
FGM is practiced in Nigeria and is clarified into 4 types, which range from type 1 to type 4. Type 1 is the least severe. It involves the removal of the hood of the clitoris and all parts of the clitoris. Type 1 and type 2 are most widespread, but less harmful compared to type 3. Type 3 is the most severe form of FGM. It involves the removal of the clitoris, the labia minora, and adjacent medial parts of the labia majora, and the stitching of vaginal orifice, leaving an opening of the size of a pinhead to allow for menstrual flow or urine. Type 4 is any other form of female circumcision, which is unclassified and includes traditional practices. FGM is recognized worldwide as a fundamental violation of human rights of girls and women. It reflects deep-rooted inequality between the sexes and constitutes an extreme form of discrimination amongst women. It is involved in violation of rights and children and a violation of persons' right to health, security, and physical integrity, the right to be free from torture and cruel, inhumane, or degrading treatment, and the right to live when the procedure results in death. Furthermore, girls usually undergo the practice without their informed consent, depriving them of the opportunity to make independent decisions about their body.
Anecdotes from Nigerian women found that they justify FGM for hygiene, aesthetic reasons, protection of virginity, and prevention of promiscuity, modification of socio-sexual attitudes, increasing sexual pleasure of husband, enhancing fertility, and increasing matrimonial opportunities. However, FGM is often routinely performed as an integral part of social conformity and in line with community identity. In Africa, about 3 million girls are at risk for FGM annually. Despite the increased international and little national attention, the prevalence of FGM overall has declined very little. The procedure has no health benefits for girls and women. Adverse consequences of FGM are shock from pain and hemorrhage, infection, acute urinary retention following such trauma, as well as many sexual and reproductive consequences, including difficulty during labor and delivery. The mental and psychological agony attached with FGM is deemed the most serious complication because the problem does not manifest outwardly for help to be offered. The young girl is in constant fear of the procedure, and after the ritual she dreads sex because of anticipated pain and dreads childbirth because of complications. Such girls may not complain but end up becoming frigid and withdrawn, resulting in marital disharmony. FGM is an extreme example of discrimination based on sex. Often used as a way to control women's sexuality, the practice is closely associated with girls' marriageability. Mothers choose to subject their daughters to the practice to protect them from being ostracized, beaten, shunned, or disgraced. WHO is strongly against this medicalization and has advised that neither FGM must be institutionalized, nor should any form of FGM be performed by any health professional in any setting, including hospital or in the home setting.
It is true that tradition and culture are important aspects of any society in helping to mold the views and behavioral patterns of this society, but practices like FGM are harmful and should be amended. A multidisciplinary approach is needed to tackle this deep-rooted legendary practice of FGM. There is need for legislation in Nigeria involving healthcare professional organizations, empowerment of women in the society, including education and awareness of complications, as well as education of the general public at all levels with emphasis on dangers and undesirability of FGM in order to help promote social change. So that's our video. and look at the discussion questions below. Bye.